Good afternoon. Thank you for joining us today for our COVID update. We continue to see positive direction in pretty much all fronts surrounding COVID-19. Our case numbers continue to be low. The revised estimates that were put out yesterday have our case rate at 5.5, which again is another step in the positive direction we're headed. We've now crossed the 1.5 million vaccines administered threshold, and San Diego continues to do incredibly well at very rapidly getting shots in arms. We're also encouraged. We're being told our allocation for next week will be 10% higher than it was for this week. You'll remember this week was about 9% higher than last week, and so we are beginning to see sustained increases in the availability of new vaccines. We would like to see much larger jumps, and we certainly have much more capacity. But again, we are building week over week and seeing increases in the number of vaccines we're receiving. We ask the public to continue to be patient. There's a large number of San Diegans that are now eligible for the vaccine, and we will not have enough to meet the need. But we are encouraged. Again, next week's allocation 10% higher than this week being 9% higher than last week, and so we are headed in the right direction surrounding that. I wanted to briefly talk about the capacity of our vaccine system. I know that we have gotten some questions this week. We opened additional sites. One at Viejas Arena at San Diego State University can do about 1,500 a day. We launched a partnership with the Mexican consulate, and we continue to assess other locations, either for individual walk-up sites or some one-day sites, and also looking to build out our capacity. But with the capacity we have now at the 27 county-sponsored or county-administered sites in San Diego County, we could do about 35,000 vaccines per day, every single day, just at those locations. Presently, with the supply of vaccines, we're only doing about 12,000. And so even with the Petco site coming offline, we still have significant capacity within our network, and we have the ability to ramp that up and do even more. And so we are prepared for an influx of vaccines. And we do often get asked, why do we continue to add sites like Viejas when we have limited vaccines? We are preparing, one, to have a regionally distributed system where people have easy and convenient access in, but two, we are preparing because those week-over-week numbers could jump significantly, and we want to be prepared and ready to do that. So again, we are continuing all of those efforts. We're also continuing to improve our system around homebound seniors. That got off to a rocky start. Provider was in, provider was out, and we've been playing catch-up to try and get that effort back on track. Last week we shared that Sharp Healthcare was involved, and we appreciate their help. They're doing between 25 and 30 homebound seniors a day. And again, important to keep in mind, this is very challenging. You have to take all of the associated infrastructure to an individual's house, wait with them the appropriate amount of time, and then pick up and move to another site. We are working with Tri-City to come on and help in North County. Our CAL FIRE teams are helping for homebound seniors in more rural parts of our county, and we are in conversations with UC San Diego about potentially repurposing some efforts and having them join the effort as well. Again, we want to get to all of those homebound seniors and get those done. I also wanted to share with you 100% of our skilled nursing facilities have now had their second dose administered, and 94% of our long-term care facilities have been visited for their second dose. So we should finish both of those here in the coming days. We are mindful new people come into skilled nursing facilities and long-term care facilities, and so we're working with those facilities to help ensure as new residents arrive, we can ensure they're vaccinated, or if not, provide a method or means to get them vaccinated. So again, we appreciate everyone's continued patience and help as we work through this. San Diego continues to be a leader and do well, and we're hopeful as the supplies increase, we will be able to move even faster. I wanted to talk for a second about the tiers. We're obviously in the red tier right now, and there have been questions about what is the pathway we would descend to the orange tier. And there's essentially 3 different paths at which we could go to the orange tier. But I want to preface it by saying all of these involve us controlling our case rate. And so we are on a good direction. We are on a good trajectory. We are seeing other areas of the United States, other countries around the world that are having significant increases. We have not seen that to date in San Diego County. I think because the vast majority of San Diegans continue to exercise caution. We continue to embrace utilizing the mask and face covering. We continue to avoid high-risk settings, and we are taking a responsible reopening path. And I think it's vitally important, both for our economy and just for all of us, that we reopen in a smooth and consistent manner. And so we continue to ask the public, please be cautious. We're doing a really good job here in San Diego County, and we want to continue that. And the possibility of descending into the orange tier ought to be extra motivation for each and every one of us to continue to do our part to help avoid the spread. So the 3 pathways for how we could get to the orange tier, the one is the most traditional one. We're used to the normal tiered structure. That would require us to have our case rate under 4 for 2 consecutive weeks. And although we are descending, it is probably less likely we would get under 4 in the immediate future or have a chance to do that. But if our case rate descended to 3.9 or less for 2 consecutive weeks, then we could descend to the orange tier. The second pathway to get there, and the one that is most likely for us as a county, depends upon the state of California administering 4 million vaccines in that top quartile of the Healthy Places Index zip code. You remember the state got to 2 million, which is what loosened the restrictions around the red tier. When we get to 4 million, it loosens the case rate associated with the orange tier. Right now, the state of California is at 2.9 million in that quartile, so really impossible to predict, but certainly advancing at a decent clip. But when the state hits 4 million vaccines administered in the Healthy Places Index's quartile, that changes the math for the orange tier. And to go into the orange tier, you would need 2 consecutive weeks with a case rate of 5.9 or less. As we stand here this week, our case rate is 5.5. So if the state were to hit that threshold and we were able to keep our case rate where it is now or lower for 2 consecutive weeks, then we would be able to descend into the orange tier. We think that is the most likely path for us as a county to descend down. So again, we need the state to hit the 4 million mark statewide for vaccines, again, in that first quartile for HPI communities. And then we would need 2 weeks of case rate at 5.9 or less. We're there right now. This week we're at 5.5. So again, extra motivation for us to not see increased spread and increased transmission. The third pathway for us to get there is related to the healthy equity testing positivity percentage and testing positivity percentage. Essentially, we would need 2 consecutive weeks with both of those numbers in the yellow tier, and that would allow us to descend 1 to the orange tier. So little complicated, 3 pathways to get there. The second one I outline is the most likely scenario for us to descend. But again, all of them depend on us controlling the spread of COVID. So what we really need to know is, as we want to descend to that orange tier, allow folks to open up more capacity, more folks in Petco Park, more opportunities for things that are out there. We simply need to do our part to slow the spread and control the spread. But we are on a trajectory and a pathway to get there. Final point, and Dr. McDonald is here to answer questions on this. We have detected as a county 2 cases of the Brazilian strain, 1 resident and 1 non-resident case. Again, you've seen numbers of the different variants throughout San Diego County, but we have detected two of those cases, 1 resident, 1 non-resident, and Dr. McDonald is here for that. Dr. Wooten is here as well for any questions folks may have. But before we go to the questions, let me invite up Vice Chair Nora Vargas for her update. Thank you.
Thank you, Chair Fletcher. I do want to share a couple of updates today that I think are really important. Is that at the last press conference, I was able to share good news about vaccination rates, seniors in South Region. And today I am happy to share that we are at 98.5 of seniors 65 and older have received at least one dose of the vaccine. So that means our interventions are working. This is due in large to the intervention programs from Project SAVE that were designed to ensure that our most vulnerable communities have access to vaccine appointments. The county as a whole actually has increased as well. We're at 75.8% for people who have had access to one vaccine at least. Due to the success of Project SAVE in South County region, I am also very happy to announce that we will be expanding these efforts to the communities of Oceanside and City Heights. More details of these particular expansions are going to be coming, but I'm really happy that, the whole purpose of the pilot programs was to see if the interventions were working in our most needed communities, and they worked, and so we're going to be expanding to the rest of the county. The other thing that's important to note that another effort to ensure that vaccine access is the availability of MyTerm websites. Now we have them in 12 languages. The website is now available in Armenian, Japanese, Khmer, Punjabi, and Russian, along with languages already offered simplified and traditional Chinese, Korean, Spanish, Tagalog, Vietnamese, and English. For individuals who are eligible for a vaccine but do not have internet access, you can call MyTern's toll-free hotline 1-833-422-4255 to sign up for a vaccine appointment. This hotline is going to be open weekdays from 8 a.m. to 8 p.m. and on weekends from 8 a.m. to 5 p.m. MyTern operators can provide on-demand assistance in English and in Spanish, and they have translators who speak more than 250 languages available as needed. Estamos esperando, para que todos ustedes sepan, estamos ahora esperando más del 10% de incremento de vacunas en el condado de San Diego. Estamos muy contentos. Sí le pedimos a las personas que sigan teniendo paciencia, porque aunque en realidad se están expandiendo las diferentes fases, todavía estamos esperando que lleguen las vacunas, pero como comentábamos, esta semana tuvimos 9% incremento, la semana que entra viene otro 10% de incremento de vacunas. Como mencionó el chair, brevemente quiero tomar la oportunidad de dar las gracias y comentar que ayer se inauguró un nuevo centro de vacunación en el Consulado General de México. Estamos muy contentos ya que a partir de hoy, miércoles 24 de marzo, el centro de vacunaciones estará abierto todos los martes, miércoles y jueves de las 9:30 de la mañana a las 3:30 de la tarde, y se van a proporcionar vacunas con previa cita. Importante porque vamos a manejar la cantidad de citas dependiendo del número de vacunas que existan. Así que si usted ya es elegible para la vacuna, puede hacer su cita en el consulado para su vacuna sin importar su estatus migratorio. La cita la puede hacer a través de la página coronavirus-sd.com/vacuna. El sitio de vacunaciones en el consulado tendrá hasta 100 vacunas diarias dependiendo del suministro disponible. Así que muchísimas gracias al cónsul general, a todo el equipo del Condado de San Diego por esta oportunidad. Y por último, es importante recordar que ya viene la Semana Santa. La Semana Santa es la semana que entra, y quiero recordarle que es muy importante seguir con las indicaciones de salud pública. Estamos todavía en la etapa rojo. Para poder llegar a la etapa naranja, existen todavía varias etapas que tenemos que pasar, pero lo más importante es que sigamos trabajando juntos, ayudando a nuestros vecinos para que tengan sus vacunas, y nosotros trabajar juntos para que podamos seguir mejorando como comunidad. No deje de usar su cubreboca, no deje de seguir todavía lavándose las manos, siguiendo trabajando con las comunidades para que la gente tenga acceso a sus vacunas, y ante todo evita reuniones grandes, aunque sabemos que son épocas donde queremos estar con nuestros seres queridos, pero es muy difícil si todavía no están vacunados. Así que muchísimas gracias.
Thank you, Supervisor Vargas. We'll now go to our call-in questions.
Our first call is from Amy Taxon with the Associated Press.
Oh, thank you so much for taking our question. We'd like to know, how is San Diego County able to open up to so many medical conditions, when state health officials have asserted the need for a statewide vaccine system, we'd also like to know what measures, if any, have been taken to ensure that people with disabilities and those with the most serious medical conditions listed by the state don't get crowded out. Thank you.
Yeah, thank you. Amy, you cut out for a second there, but I just want to be clear. Your question is kind of about any potential differences between San Diego County vaccine system and the state. Is that right?
Yes, we'd like to know why, how San Diego has added so many other categories of people to be eligible for a vaccine when so many other counties have not, and the state says we need to have a system. And also, we'd like to know if you're taking any measures to ensure that people with the most serious conditions aren't crowded out while they're trying to get a vaccine by people with other conditions that may be less critical.
Got it. We'll have, Amy, I'm going to have Dr. Wooten address your question for you.
Thank you.
So thank you for that question. As I stated at our last press conference on March 12th, we contacted the state and let them know that we were adding the other underlying medical conditions that are on the CDC's website. So we didn't just create these conditions out of nowhere. They are in the category that CDC states these underlying conditions might cause severe disease if people contracted COVID-19. And so we included those as the state said they were planning to include them on the following Monday, but apparently they did not. And we continue to have them on our website. Now, and we continue to have them there today. So they are on our website. And I think it's important to note that what makes asthma less severe or than, say, type 2 diabetes or type 1 diabetes less severe than type 2 diabetes. There are categories on the website, or rather in My Turn, where you can identify yourself or register to get a vaccination so that it is not out of conflict. But these are just additional conditions that we included because we know that there are individuals that have these underlying conditions and could have severe disease, people that have cystic fibrosis or that are immunocompromised or have neurological conditions such as dementia. But again, this is a category from the CDC's website that we included, and we wanted to make sure that these individuals also had access to the vaccine. Thank you. Good.
Thank you, Dr. Wooten. We'll go to our next question.
This next question is from Melissa Adan with NBC7.
Hey, good afternoon, everyone. I'd like to ask about the Brazilian strain of COVID-19. I remember earlier this year when we were talking about that UK strain. So what impact does it have to our community? Is this strain more contagious, or what should we know?
Yeah, we'll have Dr. McDonald address that. Thank you.
Thanks for that question. You know, the CDC describes different variants that they follow very closely and that we follow very closely here in San Diego. There are variants of interest, ones that might be more impactful to the population. Then there are variants of concern. Those are ones that have increased transmission, might have more severe disease leading to hospitalization and death, might be have decreased neutralization by antibodies by either vaccine or by convalescent sera, which means that there may be an increased risk of reinfection or a risk of decreased effectiveness of vaccines, or might not be detected in the tests that we use. So that's the definition of a vaccine of a variant of concern. And the Brazilian variant in particular is one that does have decreased neutralization by sera, which means that it is possible that the vaccine may be, or some vaccines may be less effective, or that somebody who's already had COVID might be reinfected with the strain. It does not necessarily appear at this time that it's more transmissible to others, but that's again something that's being researched. And I don't believe that it's been demonstrated whether that specific variant it results in more illness, more severe illness, or risk for death. The important take-home message is that this virus evolves all the time, and that this is one of the viruses or variants that's been detected in the world and has now been detected for the first time in San Diego, and that we just need to be very vigilant about all the things we're already doing, just as we mentioned after we first detected the B.1.1.7 variant, or so-called UK variant. So hopefully that answers the question.
Yes, that's great information. I would just ask a quick follow-up then. I guess what would be the message then about the vaccines, right? So hearing it can be worrisome saying if it might be less effective, what happens then?
Well, the message of the vaccine is that you should get it when it's your turn. That message has not changed. And again, this is important for scientists to look into as the time goes by, to see if there might be a need way down the road for a booster, for example, that might cover new variants. But the take-home message right now is you don't need to do anything different. Just practice the same precautions and get the vaccine when it's your turn.
Excellent. Thank you so much.
Thank you. We'll go to our next question.
This one will be from Matt Hoffman with KPBS.
Hello. I know we're not seeing crowds like spring break crowds like they are in Miami, where they have to have put some more restrictions there. But I know you guys at the beginning of the pandemic were tracking like some of the surges in crowds, like using people's phones and data from their phones. As you're reviewing some of that data now, what are you guys seeing? Are more people coming to the region? Do you expect that to increase as students hit spring break here?
You know, Matt, I'm not aware. I haven't looked at the mobility data in quite a while. We could go back and look at the sources where we were reviewing that. Certainly in the early days of the pandemic, we spent a lot of time with that. So we could go back and look at that and probably circle back with you. I think in general, look, people are out more and they're moving more. We went from the regional stay-at-home order to purple, now to red. We have more schools that are opening up, businesses that are restarting. More opportunities for folks to move out. And so we think as a part of the recovery process, it would certainly show that people are out and about more. What we really encourage folks to do is, again, be mindful of those really high-risk settings, those large indoor settings, continue to be concerning, and then continue to utilize the safety, relative safety of a face covering. And so we think as we come out of this, we are going to see people moving around more. We're going to see more things open, and I think a lot of that is actually encouraging. We just want to continue to do it responsibly and safely.
And then to sort of follow up on that, I know there's no updated CDC guidance for travel, but they are recommending against it. With spring break here for some and nearly around the corner for a lot of students in some of the biggest districts, should San Diegans be traveling right now? And when they come back, if they do travel, do they need to quarantine?
I don't think there's any quarantine restrictions. I'll have Dr. Wooten address that. I'm not aware of any quarantine restrictions surrounding travel. But I think, Matt, our message is we want people to be safe, and we're asking folks to be responsible. And so if they, make that decision to travel, again, do it responsibly. And at this point we're a year in. Folks know the individual steps and actions that we can all take to give yourself a higher probability of safety. And again, I think as we talked earlier about, we're looking at the prospects of descending into the orange tier, and we've just got to keep our case counts down. And a part of that is obviously vaccines, and a part of that is also the individual choices that we all make. But I'll have Dr. Wooten add anything to that.
Thank you. There are no travel restrictions leaving or entering back into San Diego. But we do advise people when Chair Fletcher talks about traveling responsibly, know what the guidance are for countries that you are traveling to. Many countries that you travel to will require you to have a negative test before you enter, and sometimes even before you enter the country. So that would require that you obtain that 3 days, 72 hours beforehand. Or some airports have testing capabilities at their respective airports. So just know the regulations for the locations that you're traveling to. But again, there are no restrictions that are imposed in San Diego or actually even for the country. Thank you.
Thanks.
Hey, Matt, real quick on that. I just pulled the latest, the state travel advisory, and we don't have any restrictions from San Diego County, as Dr. Wooten stated. But the state still does have guidance and advisory in place encouraging Californians to avoid non-essential travel more than 120 miles from someone's place of residence. Again, it's encouraging Californians to avoid non-essential travel. And then it also is encouraging folks to self-quarantine for 10 days if they do travel to another state or country. And we can send you a copy of that. So in San Diego, we don't have anything additive to that, but the state of California travel advisory remains in effect in terms of advice for Californians. All right, next question.
This question is from Hunter Sowards with KUSI. Please go ahead.
Hi there. Thanks so much for taking our questions today. I've got a couple. The first being Blue Shield's going to be taking over the vaccination distribution soon, or at least contributing to it. Do we have a clearer picture of what that's going to look like moving forward? And then my second question is, we know that a significant amount of doses right now are being set aside for teachers, but records continue to show that they don't appear to be taking advantage of them. So why do we feel those aren't going used? And are they taking away from doses that other sites could be administering?
Yeah, let me take the second one first. We addressed this last week and have addressed it multiple times, but there's no doses that sit on a shelf waiting for teachers to take them. That's not how it works. What we do is make available a percentage of what we get if they have appointments to fill them. And then if they don't have appointments to fill them, they get distributed into the regular system. So there's no doses sitting on a shelf somehow that are restricted for that. We make them available. If they have the demand and the need for them, then they're provided. If not, then they're provided to San Diegans who are in any of the additional tiers. So it's not in any way impacting the ability of folks to be able to get them. On the second one on Blue Shield, we have not seen any significant change. We work with the state of California and now with Blue Shield as a third-party administrator in getting the allocations for counties. And then we work with all of the sites we have and the partners and providers that we have in place. So I didn't think at the outset there would be any significant change from this, from how we were operating, and we still have not seen any significant change to our regular operations surrounding what we're doing. I think everyone has the same goal, to equitably get vaccines in arms as fast as they possibly can. And I think that state leaders and certainly Blue Shield recognize San Diego County has done a really remarkable job of being able to rapidly and quickly get shots in arms through the network we put out, and in particular the very collaborative partnership we have with all of our healthcare system partners. So we haven't seen
Right.
any changes surrounding that and don't anticipate, but if we do, we'll certainly share that.
Okay, yeah, because that was what I've been speaking to those health partners, and that was their maybe concern, was that when they know they have a problem with maybe not getting the vaccines that they were thought to be getting, they would go to the county for questions. I had a lot of those CEOs saying, we're not sure if that's going to be the same level of who we go to. Are they going to be continuing to go to the county for questions about dose administering?
Hunter, we haven't seen any change to what we've been doing. So if it changes in the future, we'll share that. But to date, we haven't had any changes.
Okay, so it just hasn't started yet. Has that not?
No, the engagement has started. We are working with them. We signed
Okay.
an MOU with the state. We just haven't seen any noticeable change
Gotcha.
in how the system works.
Okay.
Yeah.
Okay, thank you.
Thanks. Next question.
This one is from Derek Stahl with ABC 10 News.
Hi there. I have a question about the progressing to the orange tier in just a moment, but I want to ask one quick one about the Brazil variant first. Were either of those individuals vaccinated? And can you characterize the severity of the disease that they endured? Did they have to go to the hospital or anything like that?
Dr. McDonald address that, and then we'll come back for the orange tier.
Sure. Thank you for that question. Neither of the individuals were hospitalized. Actually, both promptly recovered from their illness. Neither one of the individuals had been vaccinated. So thank you for allowing me to add that extra information.
And do you suspect those cases were travel related or related to community spread?
The resident of San Diego County had no travel history, so that means that that person, and no one that they were aware of who had traveled. So that means that there must be at least one other case in San Diego that's undiagnosed. And the other individual, the non-resident, was in fact an international traveler and was likely exposed overseas.
And you think those cases are not related, based on what you're saying?
We actually know that they're not related, so thank you.
Okay, thank you. I have a quick follow-up on the orange tier now, and I want
Yes.
to thank Supervisor Fletcher for the very detailed breakdown. That was excellent. In terms of timing, though, when you talk about that vaccine-adjusted path, the most likely path, once the state reaches 4 million shots,
Yep.
do we have to spend another 2 weeks in that 5.9 case rate zone, or do we hit 4 million and they look back and they give us credit for already being there for let's say 2 weeks?
Yeah, no, Derek, that's a great question. They look back, and so we would get credit for any point at which we had been what would then be the revised orange tier, which would essentially be 5.9 to 2. So you would need 2 weeks in that, but it would look back. And so this week we're at 5.5, and so we would just need 2 consecutive weeks consistent. Now they've got to be consistent. You can't have some broken time in there, right? You got to have two consistent weeks in there. But if we have 2 consistent weeks under 5.9 when the state hits 4 million, then we would be eligible to descend into the orange tier. There's a little caveat in there that we need to be in red for 3 weeks, but I think when you look at the timing, that's not really going to be an issue because you would need 2 weeks anyway. So that's, you may read that, but we don't think that would impact our ability. So yes, to answer your question, it would look back at your case rate.
Okay, thank you. And then I'm trying to figure out the earliest possible date that we could reach orange. You talked about the 3-week requirement, so that would put the earliest date at April 7th, Wednesday, April 7th. Based on what you're seeing, is that a likely scenario? Is there any shot that we could reach orange on April 7th?
You know, Derek, you've been around there for a little bit here. We try really hard to not predict what COVID is going to do, and so I'm reluctant to put a probability on that being a date because we don't know if the state's going to hit 4 million. You know, again, we're at 5.5, which is you know awfully close to 5.9, and a lot of folks are moving around and doing more things. And so I think that your assessment is right that it would be possible that on that date we could descend into the orange tier. I wouldn't want to say at this point is it probable. But I think you're right that would be the first date that it would be possible. But again, this is why we need folks to continue to be careful because, you know, if we were to tip up, you know, just to 6.0, then that would start that 2-week clock all over again. And so we want to keep our case rate low. We certainly to have a shot at going to the orange tier. We want to stay in that below 5.9 level. So I think you have correctly identified the first possible date that it could happen, but again, it is dependent upon both our case rate and how rapidly statewide we get to 4 million vaccines in that quartile.
Thank you so much. Appreciate it.
Thank you, Derek.
Okay, our final question will be from Paul Sisson with the San Diego Union Tribune.
Thank you for taking our calls today. Had a few follow-up questions about these Brazilian variant cases. I take it these are both the P1 variant. It sounds like it from previous descriptions. I wonder if we can confirm that. And I wonder if we could say something about how they were detected. Was this some sort of genetic surveillance? Obviously you would need to do an additional genetic step after they tested positive. So I wonder if you can say how they were detected and also how many close contacts each of these 2 individuals were found to have had during contact tracing and kind of what you've done with those close contacts.
Thanks, Paul, for those questions. It is indeed the P1 variant. That's the variant of concern. I think we'd actually previously announced that one of the other Brazilian variants, the P2 variant, had in fact been detected in San Diego previously, but this is indeed the P1 variant. The San Diego resident was picked up through whole genome sequence testing sponsored by the CDC through national laboratories. So the CDC has a contract with Quest and LabCorp and a couple other national laboratories, and they test a certain percentage of those patients. And that's how that specific individual was picked up. and the non-resident was actually picked up through our local system here. It was a test that was actually done by our public health lab and then sent routinely to Scripps Research Institute, and it was whole genome sequenced there. So that's how we've picked up those two cases. Did I?
In terms of the contact tracing?
Oh, contact tracing. I knew there was another part, but I forgot. Yes, actually, other than the household contacts of the resident, there weren't really any concerns with. It was less than a half dozen individuals for the county resident, and the non-resident had exposures that were actually outside the country. So we went ahead and notified our partners in the Centers for Disease Control to make the normal notifications back to the both the airline involved and the I'm sorry, I meant to say the transportation involved and the other countries involved. So that's as much detail as I can give on that, but no significant contact tracing for San Diego County residents who were exposed.
And Doctor, just one additional question. This involves the current level of new cases that are coming in. You know, we had St. Patrick's Day and a change of tier last Wednesday, a week ago now. We know that the average incubation time for coronavirus is about 5.7 days. What do you make of the fact that we haven't really seen much of a surge in cases kind of Tuesday? Maybe, I guess we don't have a number for today, but I imagine you would have mentioned it if we had a massive surge today. You know, does this indicate that, that vaccination really is having some significant effect on preventing additional cases?
You know, that's a note. You're asking in a different way questions that were asked with the supervisor earlier about predicting the future. I think we are certainly in a trough, and I think that you've noticed that the numbers have been relatively steady for a number of days. We would love to see that gradually downslope to allow us to progress to the orange and then eventually the yellow tiers. So we would expect that. But you know, you've identified some possible contributing factors that San Diegans need to be remaining vigilant about. So the spring break issue is probably not as big a deal for us here in San Diego as it is perhaps for Florida. But certainly that and St. Patrick's Day and other contributors could be things that could bend the curve upwards, and that's what we don't want. We want to have the continued decrease. I strongly feel that the effect of vaccinations is what's really contributing to that, and if we can stay the course during this next 4 to 6 weeks, then I think that we will be on a great track.
Thank you, Doctor.
That concludes our briefing for today. And my exuberance to take your questions, I forgot the charts for today, but they're posted on our website. I think we covered most of the material in there. So with that, thank you everyone for tuning in, and we will be back with you next week. Thanks.